Prof. Goolam. So just, I hope everybody can hear me. A warm welcome to the first AAPS webinar. It's quite a historic occasion. It's a first, so, and I think it's exciting. COVID has caused a lot of trouble, but it's also opened up exciting opportunities. So just to alert you, this is the first of a number of webinars we've planned that would run the course for the rest of the year. And it's quite exciting. And so we're going to kickstart today with a very high profile speaker. It's my pleasure to briefly introduce you to Professor Goolam Mohamedbhai. He lives in beautiful Mauritius. I think they're 2 hours ahead of us. And he's currently an independent consultant in higher education. And he's got a special interest in Africa. So he was a former Vice Chancellor of the University of Mauritius, Secretary General of the Association of African Universities, and President of the International Association of Universities. And he's currently acting on a number of boards and committees. So he's a very active person, and he has some time for retirement in between, he told me the other day. So, and today he's going to touch on quite an important topic, looking at COVID and its impact on higher education, and particularly within the African context. So I think that's going to be quite useful to all of us. So please feel free to question. Just how we'll do this is that we request you to, once Professor Goolam starts, we all switch off our mics and our video, and then there'll be an opportunity for questions. He's going to talk for about half an hour after that. Please raise your hand, or you can post a comment on the side, and then we'll allow about 20 minutes for questions. There's also attendance certificates available for those who need it, and that can be obtained from the AAPS's office, Mrs. Nahla Mustafa, via that AAPS Gmail address. So if you need any further information on that front, don't hesitate to contact myself or anybody in the AAPS Council. So without further ado, I'd like to call upon Professor Mohamedbhai to talk to us about COVID and higher education within the African context. Over to you, sir.
Thank you very much indeed, Fadil, for this introduction. Let me say good morning, good afternoon, good evening to all the participants, wherever in the world you may be. And let me start by thanking the association, the African Association of Physiological Sciences, for inviting me for this to this webinar, and also for giving me an opportunity to speak about this I think, very important topic of the impact of COVID-19 on higher education in Africa. As we know, this pandemic will leave no sector in any country in the world unaffected, and its consequences will be felt for years to come. Higher education is, of course, no exception. It is therefore important for us to understand the impact of the pandemic on higher education and the resulting consequences. And I'll try over the next half an hour or so to give you my thoughts about this particular topic. An outline of my presentation. First of all, I'll say a few words. I'll give you an overview of COVID-19 in Africa. Then I'll spend some time on teaching and learning In fact, this is where most of the activities is taking place. So we'll spend a little bit more time on teaching and learning to look at what has been the immediate response of universities, the issue of remote teaching and online learning, what have been the challenges in migrating to online teaching, and finally, what has been the impact of this pandemic on teaching and learning. I'll say a few words about private higher education institutions and also on research, which of course is very important, and then graduate employment. And I'll end with a set of conclusions just to summarize what I've talked about. Right, an overview, first of all, of COVID-19 in Africa. And the statistics that I'm showing here, as you will see in the slide, are as at 11th of July 2020. We are 15th today. During those 4 days, I have no doubt at all that all the figures have changed, have gone up. But at least, we'll get an idea of what the situation is at the moment. So for Africa as a whole, as a continent, we have, which has a population of 1.3 billion, we have something like 560,000 confirmed cases, with deaths of those confirmed cases, about 2% deaths, about 13,000 people who have died, and 49% recoveries, and the same number of active cases, actually. This is the situation for the whole continent. Assuming that our data are reliable, and one cannot be sure whether they are. In some countries in Africa, they may be, in others, they may not be, but let's assume that they are reliable. Then I think we can say that Africa is significantly less affected than other world regions. In other regions, the situation is much worse. You can compare Africa, in fact, even to large countries, for example, United States or India. If I can quote you the figures of the United States, it has a population of roughly 330 million. That's 25% of the population of Africa, and yet the confirmed cases are exceeding 3.3 million. It's quite serious. Let's take the case of India, large country, a population of 1.38 billion. That's slightly larger than the continent of Africa. And it has confirmed cases at the moment of something of the order of 800 to 900,000. So by any comparisons, I think we can say that Africa is doing not too badly. But let's look at what's happening as far as countries are concerned. And I've picked the 4 countries which have the largest, the biggest confirmed cases so far: South Africa, Egypt, Nigeria, and Ghana. Interesting to note, all these 4 countries have a very well established, very well dynamic higher education system. Other countries have too, but these countries are renowned for their good higher education system. And the thing that comes out immediately is South Africa. For a population of only 559 million, it has already recorded 250, over 200, from what I understand now, it's over 260,000 confirmed cases. Whereas for the other countries with larger population, like Egypt and Nigeria, much lower number of cases. And with Ghana, only 330 million, about 23,834. So clearly, South Africa has a problem. It is the worst affected country. And it is the one which is known to have an excellent higher education system. Not only that, it plays a very important regional part because it does attract a lot of students from the SADC region. So I think clearly we have a problem as far as South Africa is concerned from the point of view of COVID-19. If I may be allowed to share some figures from my own little country, Mauritius, we are very small, of course, a population of only 1.3 million, a small island. So that can explain some of the things I'm going to say. But I think we have been known, it has been published in a number of magazines and articles and so on, that Mauritius has managed its, the COVID-19 extremely well from a health point of view. Let me give you a few figures. We've had so far 343 cases, confirmed cases. We've had only 10 deaths so far, and the recovery rate Out of this 343, 330 of them have completely recovered. So the recovery rate of 96%, which I think is exceptionally good. And we've had no new local confirmed case over the past 2 to 3 months, none locally. There have been a few cases, a couple of cases imported from other countries. This is through repatriation of merchants who are overseas. So I think there are reasons why we've done well, but nevertheless, I think we should take credit that we've really managed the pandemic extremely well. Let me now go to the big area of teaching and learning, and we'll start with looking at the immediate response of the institutions, how they responded. Well, following the lockdown of the various African countries, and in some cases it was partial, in some cases it was complete, most of the higher education institutions closed around the 3rd week of March this year. In Mauritius, it was actually 19th of March, with, I think what it is important to remember, hardly any notice and hardly any time to undertake any preparation. And the majority of the international students decided to return to their home country. In fact, thinking that they will be back very soon. Many of them left their belongings in the university where they were studying. And now they find that they cannot come back, and I don't know when they will come back. The immediate response has been to migrate teaching and learning to an online platform. That has been the response for most of the semester or the term. Remember, the new semester or the new term or the new academic year, depending on what system one uses, started in January. All this happened in March. And the semester or the term is supposed to end around June with examinations and all the rest. So you can see the urgency. One had to do something very quickly to be able to complete the semester or the term. There was an interesting survey carried out by the International Association of Universities in April 2020. The whole world, in fact, all regions, but I'm picking out the bit level of Africa. And it showed that 2/3 of the higher education institutions which responded from Africa, and there were something like 85 to 90 of them, said they were completely unprepared to move to teaching online at the time of closure. But this was April 2020, they just closed down, or hardly a few weeks after, they said they were looking at options. Not very different from a quick survey that was carried out during the same month of April 2020 of about 78 universities of AAUs, this is the Association of African Universities, which has a membership of roughly 400 universities. And they reported something that is not very different, in fact, when you look at the figures. 21 universities expect to fully teach remotely without any problem. Look further down, 16 universities said they cannot teach at all. They have no capacity to undertake any teaching remotely. And 41 universities said they can partially teach remotely. Now, if they've closed down and they do only partial teaching, how can they really complete the semester for all the students? So when you compare the figures and you look at these two surveys, basically they're telling the same stories. Universities were having difficulty at the time of closure to move their teaching online. But eventually, with a bit of struggle, I suppose, a significant number of African higher education institutions resorted to remote teaching. And I need here to clarify terminology that I'm using. I'm using remote teaching and online learning, and the two are quite different concepts in my view. You can use remote teaching, you can use distant teaching, it doesn't matter, it means the same thing, and versus online learning. What do I mean by remote teaching? This is basically posting the lecturer's notes online, to have the lecture video recorded, for example, and pass it on to the students, to have e-books and e-journals and e-publications available to the students, and to use email or mobile phone for communicating with students. So basically, it's a face-to-face situation, except that now the lecturer is in one place and the learner is in another place. But the methodology used is exactly the same as if they were in the same classroom. When we come to online learning, this is completely different. Here, You have the teaching material, which has been prepared by a professional instructional designer. The lecturer undertaking the teaching has been pedagogically trained for online delivery, and it's a different way of approaching the learning system. And the students as well, they have been exposed to online learning pedagogy, and they know exactly how they should carry on the learning. And in fact, you can have online learning on the campus itself without being at a distance. It's the methodology that changes. Now, apart from open universities in Africa, and there are quite a few of them now, there were very few African higher education institutions which have the capacity to deliver full programs using what I call online learning, not remote teaching, but online learning. Some higher education institutions had already started using blended learning, that is a mixture of face-to-face and online delivery, online learning, but none of them plan to go fully online. Let me quote you the case of my own former university, University of Mauritius, where we have good experience of blended learning, but there was never any plan to go fully online with all the programs. It was to be a mixture of the two. There have been little surveys carried out from students and so on, and generally it's been found that blended learning, this is a mixture of face-to-face and online, has the best learning outcome. And the one that for remote teaching, the unprepared remote teaching, as I call it, has the worst learning outcome with serious impact on quality. And yet, in the majority of cases in Africa, after close down, it's remote teaching that the majority of the universities were using. While they were migrating their teaching to online teaching, many of them experienced several challenges. What are these challenges? First of all, of course, not all African countries have adequate ICT infrastructure and broadband access to enable quality remote teaching or online learning. It's well known. Some are very good, some are not that good. Some are well connected, some are not. That's from the country's point of view. Institutions themselves, in some cases, some are better equipped and experienced in online delivery than others, especially those who have already experienced of blended learning, for example. And this is even in the same country, let alone in different countries. Take the case again of Mauritius, where University of Mauritius is much better equipped, in my view, and experienced in online delivery than the other public institutions, public universities, except perhaps the Open University of Mauritius, which use completely the methodology of online learning. That's institutions. The students as well have been experiencing challenges. Those in rural areas may not have access to internet, or it may be too costly. However, one should say that some universities have taken the initiative of providing free data bundles in collaboration with telecommunication companies. And some students from poorer families, in fact, do not have a desktop or a laptop for working from home. So how can they carry on with their teaching and learning? It is well known that electricity outage is very common in Africa, and this can disrupt access. And one knows also of several areas in Africa where, let alone electricity outage, you don't have electricity at all. So you can imagine if students come from these areas, the challenges that they have. Then students usually are unfamiliar with using online material. And although proper studies have not been carried out, the little preliminary data that's coming through show that generally speaking, the students are not very happy with the, using completely online material for continuing their programs. And faculty as well are not always trained to deliver courses remotely or online. And in fact, it's clear that it's the older ones that show reluctance and show little interest. And we know that in Africa, the aging faculty is an issue. A significant number of the faculty in universities are, let's say, not young, and therefore reluctant to go towards online teaching and learning. What has therefore been the impact of all this on teaching and learning? First, there has been this rush to complete the semester and the academic year, and very often with incomplete or unsatisfactory coverage of the curriculum. Inevitably, the quality of the higher education programs will suffer. And at a time, unfortunately, this is happening at a time when huge efforts have been made to improve the quality of higher education in Africa. There have been so many efforts made in establishing quality assurance agencies, of establishing external quality assurance systems, of establishing internal quality assurance systems in higher education institutions, and so on. And here we have a situation where clearly there's a problem with the quality of the programs. And I think one would say that the worst affected programs will be in science and technology, as students cannot access laboratories. And probably even the ones worse off will be medical and health sciences students. They're especially at risk because of the nature of the practical that they have to undertake. Then there's the pipeline, what I call the pipeline effect. Just as universities were closing, higher education institutions were closing, so were secondary schools. They were closing down as well. And again, some sort of attempt has been made in many schools to try and approach the students online or using technology, but not always very successfully. And because, therefore, quality of the secondary school education will probably be poor, when these students move on to higher education, there will be a further impact on quality of higher education as well. And then we have significant inequality of progress of students. Of course, we know that in a class, not all the students have the same abilities. There is variable abilities, and this is just the nature of things. But here, this inequality will arise from the fact that some of them are dependent on online access, and because they did not have online access, they cannot therefore, undertake their studies properly. And I think that's unfair. And then when universities open, very likely we hear probably September or October, international students may not be able to return because of travel and health restrictions. Probably the skies have not been opened yet in Mauritius, where the skies are completely closed at the moment, so you can't travel out or in to the country at all. And there are health restrictions as well. Almost all countries are now insisting on this 2-week quarantine requirement as soon as you land in a particular country. So if they have to spend 2 weeks in quarantine, you can imagine that their studies are going to suffer compared to national students. And the whole issue of online assessment, especially from the point of view of written examinations, arises. I suppose online assessment of projects and so on is not a major issue. But when you come to written examinations, this does raise issues of fraud and privacy and so on. And one could start questioning whether the qualifications, what is the quality of the qualifications that's being handed out. Let me say a few words about private higher education institutions. We know that there are a significant number of private higher education institutions that operate in Africa. And in fact, it's well known that in almost every country, the number of private institutions far exceeds the number of public ones. However, this enrollment in the private sector and higher education, private sector higher education, is generally lower than in the public sector. But this is changing. Private enrollment has been steadily increasing over the past decade, and there are some countries in which you have almost equal public and private enrollment. Private institutions are heavily dependent on students' fees to cover their staff salaries and operational costs. There are some faith-based institutions, it is true, faith-based private institutions they receive grants from different sources and so on. But generally speaking, one could say that private institutions depend to a large extent on the fees they receive from their students. There is a fear that enrollment in private institutions might reduce significantly because students are unable to pay fees. Remember, the economic situation of families in almost all countries is getting serious. So they may well be that they will be unable to pay fees and therefore decide not to enroll in higher education. And then you have many who are international students. Many of the private institutions enroll international students, and they as well may decide for various reasons, health reasons or economic reasons, not to travel to attend the private institutions in other countries. This situation may well lead to closure of many private institutions, and this could have a dramatic impact on the higher education sector and the country's development. I know it has often been argued that many private institutions are of poor quality, basically business enterprises and so on, and this is true. But there are many as well who are doing quite a wonderful job in supporting the public sector, in meeting the enrollment requirement of the country, and some very, very good private universities in Africa, especially the faith-based one. And if they start closing down, I think it could be very serious for the sector. Now, we hope that all African states will support their public higher education institutions financially, although I think perhaps with reduced grants. We hope not, but it is a thing that I think institutions will have to face. But the question arises, can states also assist private institutions in some form? This is something to be debated. This depends on policy in different African countries, but I think it is important to understand that this is an issue that has to be grappled with, the private institutions. After teaching and learning, let's move to, and a private institution, let me move to the other big area, which is research. There has been a plethora of projects that have been initiated at national, at regional, and at continental level to improve the research output of Africa, for the simple reason that it is well known that the output of research from Africa is poor, in fact, poorer than most of the other regions. And in these initiatives, the emphasis has been on basically doctoral training, and also projects in priority areas for Africa's development. Priority areas determined nationally, but also priority areas as set out by continentally. African Union has taken a lot of trouble to produce documents and so on to show what could be the priority areas for the development for Africa's development. And all the indicators until recently show, more than 2 decades ago perhaps, they were bearing fruits. And now comes COVID-19, and there's a slowdown in most of the activities. In May 2020, a survey was carried out by Mawazo Institute. Mawazo Institute is a research institute that is located in Nairobi, Kenya, and it surveyed some 501 academics and researchers in different parts of Africa. And it showed that 73% of them said that they had suspended their field or laboratory work because they cannot access the laboratories, they cannot do field work because of this health situation. And this will have a serious impact on their research work, on the time they will take to complete their work, and also on the outcome. In some cases, even the results could be, be affected because of the time factor. So this is the situation of current research going on. The question of funding also arises as far as research in Africa is concerned. We know that the bulk of research projects in Africa are funded by Europe, by the World Bank, and by agencies and foundations in the United States. The question we can ask is, will Africa continue to benefit from external funding, as many Western countries are facing or will be facing recession? And one can understand they have to support their own higher education institutions. They have to give priority to the research that is important to their own countries. So this is at international level, but even at national level, we may find that universities face budget cuts from their public universities, face budget cuts from their government. And whenever there is budget cut, our experience has shown that it's usually, unfortunately, it's research that gets the biggest cut. Even at national level, for the funds that are available for research nationally, that as well may be curtailed because of the problem of COVID-19. A clear example is the National Research Foundation in South Africa, where I think last week or the week before, it clearly said that it would be difficult for it. It will have to cut the amount of funding that it provides for research in South Africa. It just doesn't have the sufficient funds. So whether at international level or national level, we may be facing a serious issue of funding of research in Africa. Now, since COVID-19, there has been significant research interest being shown for COVID-19 related research in biomedical issues, epidemiological subjects, clinical subjects, and so on. And in fact, funds are being made available. One can understand because of the international crisis that we are facing. Funds are being made available for undertaking this research. And some COVID-19 projects are already underway in some of the World Bank supported African centers of excellence. And the question one should ask is, will therefore COVID-19 change the research priorities in Africa? Will there be a shift of research towards those that are important for COVID-19? If that is so, then what would be the consequence of such change on development, on other important areas of research necessary for Africa's development? And next we come to PhD training. We know that there is an acute shortage of PhDs in African higher education institutions. In some cases, as low in some departments, as low as 20% of the staff have a PhD. And there has been, as I mentioned earlier, a huge effort made to produce a large number of PhDs in Africa. South Africa, we know, trains a large number of PhDs for other African countries. In fact, the figures for South Africa are impressive. At the moment, if I understand correctly, it produces something of the order of 3,000 PhDs per year, with a plan by 2030 to produce 5,000 PhDs per year. And a number of these PhDs, in fact, are from other African countries. For South Africa itself, but from other African countries as well. And all this may suddenly come to a halt, or at least get significantly reduced, with consequences. Other doctoral training programs exist in other parts of Africa, funded internationally or whatever, but they rely on international partnerships, with collaborations with other countries. For example, there's a World Bank project which is currently being coordinated by ISIPE in Kenya, with the aim of producing something like 10,000 PhDs over a period of 10 to 20 years. And all of these PhDs is through collaboration, through international partnerships, partly done in Africa, partly done outside Africa. So these sort of programs will inevitably suffer. And so therefore, there will be a consequence of that as well. Let me now turn finally to the issue of graduate employment, or shall I say graduate unemployment. Even before the pandemic, African countries were experiencing the challenge of graduate unemployment. If you look at some of the figures, and again, interestingly enough, South Africa has got an extremely large graduate unemployment figure, but other countries as well. The figures are into double digit in many countries. And from feedback that has been obtained from employers, in fact, there was a very interesting and extensive survey carried out in three or four East African countries a couple of years ago, or 3-4 years ago, to determine what's the situation of graduate unemployment from the private sector point of view, and why there is graduate unemployment. And it revealed that one of the major causes of unemployment, especially in the private sector, is lack of soft skills in graduates. The graduates lack communication skills. In fact, they were labeled as half-baked by many of the companies. They lack communication skills. They are not able to work in teams. They can't think outside the box, and so on. And now, with all this wide use of online learning, where the students sitting at home in front of the computer and laptop, cut out from the others, although there is Zoom, there is all the other technology available, but nevertheless, it's not the same as working in a group, in a laboratory, or in a lecture or whatever. So this could well exacerbate the situation. We know that unemployment figures, you just have to look at unemployment figures in almost all countries of the world, let alone in Africa, and unemployment figures are increasing, literally week by week. And many private sector employers are being forced to lay off staff just because they don't have enough money. They're not making profits, therefore can't employ. And therefore graduates may well find it very difficult to find jobs, especially in the private sector. The consequence of this can be serious because we know that large-scale youth unemployment, and by youth I mean including graduates as well, can lead to serious social unrest. We know the example of North Africa with the Arab Spring that took place not so long ago. So I think one has to be careful to ensure that we do look at graduate unemployment very seriously. One way out is for universities and higher education institutions to place greater emphasis on entrepreneurship in all their programs so that the students don't have to rely entirely on finding a job. This has been tried, not just now, but for a few years now in many universities. But honestly, the results are mitigated. There have been some successes, but at the same time, in some cases, it really hasn't been extremely positive. One possibility would be for sandwich training attachments during the program, during the course, or even after graduation, with allowances being paid to the graduates instead of salaries. Perhaps this is an acceptable option to the employers and to the students as well. One may well argue that, the students will get much reduced funding with allowances and salaries, but isn't it better to have at least being in a job and have some sort of allowance than having no job at all? And at least if they're employed in some sectors, they get some valuable training which will be of use to them later on when things have stabilized and they can look for a job on a more permanent basis. Let me draw now some conclusion based on what I've said so far. Student enrollment, quality, research, and graduate employment. These are areas which for decades now have been identified as important for revitalizing higher education in Africa. And so much has already been done in these areas. We now find that COVID-19 could seriously have an impact on these important areas. I think South Africa is by far the worst affected country. The figures show it, and I don't think we can see any very much improvement immediately. And its higher education institutions, some of them world-renowned, receive a large number of regional students, undergraduate, but especially postgraduate, and that may well diminish. And this will have negative consequences on South African institutions, on South Africa itself, but also on other African countries, especially those in the region of Southern Africa. There are a number of higher education institutions which have been unable to migrate their teaching to online platform. We don't have the figures, the exact figures, but there is clearly an indication that a number of them have not been able to do so. And if they've been able to do so, they haven't really done it properly. And this could have serious consequences for their students who are already enrolled. Achieving equity in educational provision using online teaching is a challenge in Africa in view of the digital divide. Digital divide among countries, not all countries have the same ICT infrastructure. Digital divide among institutions with different stages of preparedness as far as ICT is concerned, and digital divide among students. Some are better equipped than others in using ICT technology. I suppose one positive outcome of the pandemic is that African higher education institutions are now fully sensitized to the importance of using ICT, not only in teaching and learning, but in all their activities. But then, are African higher education institutions jumping too fast into digitalization of their teaching and learning without properly evaluating all the consequences? This is an area where I think we need to look at and debate whether it is important to go very quickly and digitalize everything as far as teaching and learning is concerned, which may have consequences. I've already mentioned that there is a risk that a large number of private institutions might face closure, and this could affect the higher education sector generally and the countries generally as well. There are several research projects of importance to Africa's development, and which have started, which were progressing very well, and they have come to a halt because no field work and no laboratory work could be undertaken. But we must find ways and means of making sure that they continue, because it would be so serious if these are abandoned. Funding of existing and future research projects will prove to be a major challenge, and yet research is so vital for Africa's development. And while COVID-19 related research is important, no one disputes this, it should not be to the detriment of research in other priority areas. Efforts to increase PhD training, whether in South Africa or through partnership, must be maintained. Without a significant number of PhDs in Africa, I think research will continue to suffer and universities will continue to have a poor output of research. I think there is no question that COVID-19 will worsen graduate unemployment, and higher education institutions can no longer afford to ignore employment of their graduates. There was a time when universities would say, well, you know, our responsibility is to train graduates. Finding a proper job, that's their responsibility. This cannot work anymore. I think higher education institutions must take the employment of their graduates very seriously. They need to establish direct channels with potential employers. They need to consider all possible options and look for innovative approaches. And my final point is that it is vital to conduct surveys and collect and analyze data to plan what one could call the new normality of higher education in Africa, resulting from COVID-19, which is not over yet. We can't talk of post-COVID-19 yet, but it is important to collect data, analyze, and to plan. And yet we know that in Africa, especially including in African universities and higher education institutions, collecting and analyze data is one of their weaknesses, but we need to do it if we want to plan properly in the future. Thank you very much indeed.
Thank you very much, Professor Mohamedbhai. That was an excellent talk. Lots of thought, lots of discussion, I'm sure. Also a sobering talk. So I'll open up for questions. Please just put your questions in the chat if you feel like that, or raise your hand. We would love to hear from everybody. So just go ahead and then Prof can respond. Can we get the slides in our mail? You mean by email or right now? Can I reply? Well, I've got one question that popped up earlier, Professor, that I think from Dr. Shifamba in Zimbabwe about your statistics with the testing. And South Africa looking pretty bad. He put the question that is it not related to the number of tests being done? And that's maybe a false sort of negative for those countries that have relatively low numbers.
You want me to answer that, Fadil? Yeah?
Yes.
It is true. Testing is a serious problem in Africa. South Africa apparently has got a good reputation of testing, and Mauritius has got an excellent reputation for testing. So some countries are very good at testing and some countries are not. You can imagine the rural areas of Africa. How do you carry out the testing properly in such areas? So the figures, not just in Africa, but everywhere in the world, we are really looking at very, very low figures, relatively low figures compared to the true figures. That's very true, which is even more alarming because this could be even worse than what we think it is.
About the talk, we will post the talk on the AAPS website. Professor Goolam agreed to that, that you can listen to the recording at your leisure. So while we're waiting for questions, you mentioned many factors. It's a grim scenario, unemployment, we're looking at funding being cut, especially African higher education institutions. Any ways forward for us now? We're facing this, it looks quite grim, that we could reposition ourselves now, whether I'm in Tanzania or in Kenya or South Africa, to be smart how we go about things to ensure basically we get through this difficult period. Any thoughts on that front?
Yeah, I think Fadil, the one way out probably would be collaboration. I think universities must now, they were already collaborating a little bit, but I think it's time now to really collaborate and share experiences and see whether we can learn from each other and pass on information and strengthen each other in areas that we can. Apart from that, I don't see what else you can do, because where would you look for more funding if you don't have it internationally and even locally for research and so on? And also support our, make a plea towards our governments to understand that how higher education is important and how they need to support it. You know, this is not the first time higher education is going through a crisis in Africa. It has gone through it before, but universities are known to be very resilient. And I think we need to sensitize our governments that it's so important to continue to support. We understand their plight. We do understand the difficulties they're in, but nevertheless, they mustn't give up their higher education institutions. They mustn't give up their universities, and they must continue to support it. And universities must go out, reach out to government and see how can we help you? In what ways can we support you? And it has to be a continuous collaboration between the state, the government, and the universities, and also universities throughout Africa supporting each other. That would be my take. Can't hear you, Fadil. I can't hear you. You're muted.
No, sorry. Another question from Dr. Sishi, who is based at Stellenbosch. She wanted to know the success in Mauritius. You said it's relatively low and you're quite dealing successfully with the pandemic. What would be the reasons for that?
Interesting question. I think the one obvious thing is that we're an island, a small island, a small population of 1.3 million, but that's not the only reason. I think there has been first of all, we acted very fast. The government acted extremely fast and didn't wait for a major issue to crop up before starting lockdown. It locked down very quickly. The other point, I think, is that the government had set up a very high level team of professionals in the field, some of them international level, to advise as to how to go about, what are the right steps to take, what to do and what not to do. And we were having daily report. Every evening, there was a report from that team telling us, this is the situation, these are the number of cases, this is what you need to do, this is what you shouldn't do, and so on. So it's really a situation where government has shown leadership. Professionals have come forward and put their advice, which has been listened to by government. And I think the public, not all of them, but the majority of them have realized the importance of following the rules that are being laid down, accepting the health requirement that has been laid down, and stay at home as far as possible, wash hands and all the rest of it that we know. I think generally speaking, the public has responded very well.
A couple of questions, very nice. So from Dr. Shifamba in Zimbabwe, good question. I was wondering the same. So if we're saying that the economy is not doing well and we press to produce more PhDs and graduates, it's a vicious cycle, because on the one hand, we're churning out graduates and there's no jobs. So will they be attracted to come into higher education also? So, and he says, should we encourage innovation of some sort?
Good question. In fact, that question was valid even before COVID-19. There were issues as to whether one should produce a large number of PhDs, but it's a chicken and egg problem. I think if you look around the world, if you look at Europe, if you look at America, if you look at India, for example, I think the PhDs that are, most of them in Africa for the time being, will be located in universities. If you strengthen universities with staff who are well qualified with PhD and who can undertake research and so on, I think in the long term, you can't see it immediately, but in the long term, it would have a positive outcome. And it is true that it may be difficult to attract PhDs to universities in such a situation, but at the same time, if they cannot find a job outside in the private sector or wherever, isn't it the right time during these 2 or 3 years? Let's hope this will not last forever. We hope it will, the maximum will be 3 years, 4 years, 5 years before things stabilize. So it's better to be at the university, get their PhD, try and do some teaching, undertake some research, which can be of use to them later on. But I fully understand the question, and it's a question that keeps recurring all the time.
The next one is Professor Yasir Al-Wazir in Egypt. He wanted to know, with the enormous challenges posed by the pandemic, what role can be played by the public sector, and specifically professional organizations such as the AAU and the AAPS, our organization. What roles could those societies and professional organizations play under these conditions?
I would say a very important role. If you go to the website of, I don't know about your association, Fadel, but I haven't looked deeply into your website. But you just go to the website of the Association of African Universities, and it has already run several webinars, training sessions for university staff and so on. And it provides information, detailed information about papers available, research work being undertaken in various areas related to COVID-19 and so on. So I think associations have got a very, very important role to play. And as far as Africa is concerned, I know that the AAU, the Association of African Universities, is playing a very important role. The proof is, go to their website and you will find a lot of very interesting information there.
And it's relatively cost effective, that we don't have to go out. We could do it literally from our home. Oh, can you just turn down your mic? It's got a lot of...
Are we able to ask questions? Because I raised my hand.
Oh, I couldn't see that, sorry. Would you mind posting your question? It's just a lot of feedback on your microphone.
Okay, let me do that. Thank you.
Just type that. Sorry, I didn't see your hand. I apologize for that.
Okay, thanks.
Yeah, I will definitely get to that. Dr. Lamis Kadam asked about the role of women in this, under these circumstances. How will the crisis affect females in particular, staff, students, etc., etc.?
Yeah, as it is, gender is a major issue for Africa even before the pandemic, and will continue to be an issue, especially at a time when there is this contamination going on. They probably have families, they have to protect their children, and yet a lot of them have to do work and so on. Women must continue to play an important role. I mean, so they play such an important role already in Africa, and they need to continue to play an important role. And I think institutions, higher education institutions, must recognize their contribution as well and provide them opportunities to move forward, to contribute in all aspects of whatever we do at the higher education level. I don't think I've answered your question thoroughly, but that's my immediate reflection.
Okay, we're running a bit out of time, so I think we can run through the questions we've got now. So I don't think there'll be time for any additional ones that's not typed yet. So Professor Gahutu wants to know, he's based in Rwanda, is it possible to transform part of the laboratory classes into online materials? You mentioned this with science and technology and medicine. There's the lab component. Can one shift that? Any thoughts on that?
I am told by open universities, by the Commonwealth of Learning as well, that it is possible. I have no experience of it, honestly. I think one has to look into it to whether this is possible or not. But apparently many open universities do that, because open universities run programs in science and technology as well. My question is, how effective is it? And I don't want in any way to say that they're not effective and we should not do it. It's an area that I don't know, because I have to admit, I really don't know. But it's not impossible, it can be done. I suppose rather than having no practicals at all, you might as well have something that is available online. But I must admit, I really don't know. I don't have a clear answer on that.
Okay, great. So the person, Charity, could you just post your question, please? And Professor Sofala, I see as well. Your hand, if you don't mind just typing that out, then I can just read it out quickly as well.
Hello, Fadel. I'll give my talk during the round up. Don't worry.
Are you sure?
Yes, okay. Nothing important.
Okay. Then
it's about private universities, how they can survive. That's all.
Perhaps Prof could comment quickly on that. Private universities, how they will survive.
I think they will go through tough times. Honestly, because the way they are funded, there is no doubt at all that they will have difficulties. This is where I ask that question, and it's a question that needs to be debated nationally. How can, if really we believe that some of them are very important for the survival of the whole sector and for producing graduates and so on, can the state look into the possibility of finding a formula, even an interim formula, of helping those who are facing closure, sincerely and seriously facing closure? I think it's not impossible. In Mauritius, many of the private companies are receiving support from government, in other places as well. So I see no reason at all why genuine, good private institutions should not turn to their government and ask for some support to be able to overcome the difficulties they're going through right now.
Fantastic. So I've got a few more questions, and just to finish up quickly, Anwar Ramjaun wants, we've touched on this a bit, the shift for African higher education institutions towards online, specifically science and medicine. I think you've touched on that, but he wanted to know specifically any initiatives under the umbrella of the AAU in this regard.
Not that I know of. Remember, the AAU is an association of universities. It doesn't undertake any, work of that nature. But no, I'm not aware of any initiative undertaken by the AAU itself. I think there was an initiative between India and Africa at one time to do some work in this area, but offhand I can't give more details. I don't know.
Sorry, I want to call on Dr. Kapenda. I see you didn't post that. Please just go ahead with your question. Apologies, I didn't see your hand at the top of the screen. But if you could just pose your question, please.
Thank you very much, Prof. My question is just a concern. We've talked about the impact of COVID on online learning, and I'm looking at Professor Goolam as an experienced scholar. What measures can we put in place to try and overcome some of the issues, like maybe rushed curriculum, incomplete covering of the work, and the quality of work using the online teaching?
I think it would be difficult to prescribe a particular process. It will be very much dependent from institution to institutions. Some universities can do it extremely well and they can overcome it, some not. And that's why I think, in my humble opinion, I think this is a time. We know that universities in many countries don't always get together to solve their problems. They are very focused on their own institution. They carry on their own work. Sometimes they compete with the institutions in their own country. But I think this is the time when they have to join hands, when they can help each other in some cases and strengthen each other and so on, within a country, I mean. So as I said, in many countries, there are institutions which can easily overcome these problems, but there are many who cannot. So I think those who can should, lend a helping hand to those who are facing difficulties and learn from each other as well. I think collaboration is the key word.
Excellent. We've got two more questions, Prof. So then we can tie up. So the first one deals with a topic I'm also very interested in. That's the issue of stress. And so we've got to think of the impact of stress in terms of online teaching and learning on students. So any thoughts from your side how one can try and deal with that issue?
I would not venture into saying very much about it because I don't know. But here is a typical example of what I said about undertaking surveys and collecting data. Why not, if it hasn't already been done, carry out a survey? One of the universities carry out a survey of academics and students to find out what is the sort of stress that they've undergone while teaching and while studying online as well. it would be so very useful to get this data. But I can't pronounce on it because I really don't have any data myself. But I would really, if there are universities around, today, if anyone can take this up as an interesting little survey, as a little research project, it would be really interesting.
If Dr. Rasha Babakar could contact me about it, perhaps we can do exactly that. Something I'm also interested in. And then the one also concerning online assessments, examinations and tests. And we know there's lots of problems. We're all experiencing this at the moment. Do we continue with this? It's not very reliable. There's the issue of cheating. There's all kinds of things, logistics. What are your thoughts on that?
My feeling is that many universities, as far as possible, are avoiding online examinations. Although, all of us receive emails, we receive advert from private companies saying that we can conduct examinations in very foolproof ways and all the rest of it. Nevertheless, I think generally speaking, people avoid. One solution that some universities are adopting are to make sure that they have physical end-of-year examinations for final programs physically in presence and not do it online, but try and accommodate online examinations at lower levels if they're really stuck and they can't do it otherwise, so that they can then catch up later on and make sure that the quality has improved and the students are really up to it. That could be a way. But my feeling is that universities tend to avoid, as far as possible, online examinations.
We've done a lot, actually. So it's just we don't have a choice at the moment. But I've got just to wrap up, and I'll hand over to Professor Sofola to just bring everything to a close. Just for those who need certificates, please email Mrs. Nahla Mustafa at the AAPS Gmail address, and then she will arrange that for you. So I'm going to hand over to Professor Sofola just to say, Prof. Goolam, that was fantastic. We really enjoyed that. There's lots of things we can do, I think. Thanks a lot. But I'll hand over to Prof. Sofola now.
Thank you.
Thank you very much, Fadel. Good afternoon, everybody. I hope you can hear me.
Yes, we do.
Thank you very much. I'd like to express the appreciation of the AAPS to Professor Goolam for that brilliant and beautiful lecture. It's really opened our eyes to so many factors coming from COVID, because COVID itself, apart from educational, it has affected family life, employment, development, and so many factors. And it's been nice this afternoon to hear all these issues as it relates to higher education. One of the questions I was trying to ask earlier on was, so just to say that some of the issues you have raised are very, very pertinent and very germane, because this is a time when most of us are looking at the consequences of COVID-19, especially in terms of higher education. Some of us teach in private universities, that's why I brought up that issue. What is going to happen to those ones that depend on school fees to pay staff? And those are some of the issues that Africa and most of the world is going to face in the future. The other issues that you mentioned are very important also in terms of digital divide. Some of our students live in rural areas. We're trying to do online lectures. Some of them don't have bandwidth. Some of them don't have even electricity, not to talk bandwidth. Those are some of the issues that I think we as educationists will start looking into, how we can reach all our students. What we try to do here when we do our lectures is to make sure the person in charge, to find out if all the students are being reached. Because if you're only reaching 50% of the students, then you're not teaching the class. You are doing selective teaching. So all these issues are issues that are coming up that are very important. And I'm very happy that I'm able to mention a lot of these issues: equity, student enrollment, digitalization, quality of learning. And for science, education, and medicine, which I am, how do you do practicals? Are you going to do online practicals? Are you going to do online clinicals for students? Because you want to bring students in, we are being warned that if one student has COVID and infect a lot of others, you're going to have trouble. So what do you do? When does the pandemic start to recede? So those are issues that higher education institutions will have to face, whether we like it or not. And thank you that some of these issues you have highlighted extensively in your lecture. And we're very happy that you have having the benefit of your experience in all these areas, which will allow us to be able to build on what you have given us and see how you can help our continent to adapt to changes in COVID. And as Fadel has said, I hope we can put all these on the AAPS website, because it will be very nice so that we can send to all our societies in Africa, because this is a lecture that has all the ingredients that will help us to look at factors that we have to tackle if you want to improve on higher education at this period of COVID. We don't know when it's going to end. We thought it was plateauing or coming down. In some countries, it's going up. In my country, Nigeria, it's still going up. Despite the fact that I say there are 30,000, but it's going up because of people cannot obey rules, no masks, no nothing, because we cannot build them. Underdevelopment, poverty, high people living in high density areas. All these are factors. But hopefully, from this lecture, we in Africa, in AAPS, can now go back to our countries, our universities, and see how we can look at all the issues you have raised to try and perfect what we are doing, to see what we can do to mitigate some of these factors of COVID. And it's my pleasure to thank you very much on behalf of the African Association of Physiological Sciences for this very beautiful and brilliant lecture. And being our first one, in fact, you've set a very high standard, which I hope all the other coming will be able to follow or exceed. Thank you very much, Professor Goolam, for your lecture, very beautiful lecture, and for acceding to our request to give this lecture. Thank you. God bless you.
Thank you very much, Professor Olusoga. This is the very kind words indeed. But you know, I learned a lot from the questions as well. And this is a continuously learning curve that we're on. We never know what's going to happen. As you say, we don't know when the pandemic will end. So all of us are learned. And my plea to all academics who have been attending this lecture is, if try and get information and share the information, find a way of sharing your information. If you find something has worked or something hasn't worked as well, share it, please, with colleagues. Find a way through an association, through university website, or whatever it is. Share the information so each one of us can learn from each other. Because we are grappling through a serious problem and we don't know what will work and what will not work. So I think we need to collaborate and share our experiences. Thank you very much indeed. Thank you for the honor of inviting me to this lecture. It was a great pleasure for me as well. And thank you for all the participants who haven't left yet, I hope, and for listening to my lecture. Thank you.
Thank you very much, Mr. Goolam. Thank you.
Bye.
Fadel?
I think that's the end of the story, ladies and gentlemen. So we'll look forward to the next webinar. We'll post the details, and we hope to see you there. And spread the word, please. Have a nice day for the rest of the day. Bye.
Bye. Thank you very much.